Hi, I'm Amy Hesbach. I'm a physical therapist and canine rehabilitation professional. I'm going to talk to you a little bit about massage for your pet after orthopedic surgery. One, I guess, disclaimer here is that my suggestion to you is that you reach out to a professional. So whether a massage therapist certified in canine massage, a physical therapist, or a rehabilitation practitioner who might be a veterinarian or a veterinary nurse who is certified in canine rehabilitation. That person can guide you best, can give you very specific instructions for your pet based on your pet's health, your pet's injury or surgery or other needs that he or she might have. These are just some general guidelines and instructions for you to consider after your pet's orthopedic surgery and the use of massage. So what is massage? Massage is a type of manual therapy. It's a specific technique. It is also a positive, or should be a positive, therapeutic touch. I like to describe massage as heavy petting with purpose to pet owners that I work with directly with their pet. Above all, massage is putting your hands on your pet. And I cannot count how many pet owners are fearful of putting hands on their pet, especially after injury or after surgery. By reestablishing that bond, by assuring your pet that they are safe, that they should be comfortable, that touch is a good thing, will lead to better outcomes along the way, will help your pet's pain and anxiety, will help their sense of control over the situation, and will certainly help their recovery. So above all, put your hands on your pet. Again, always consider and always consult your pet's veterinarian or physical therapy and rehab professional prior to performing massage or any rehab technique with your pet. What kind of massage is safe in that immediate post-op period? And this time, touch is going to be light. We want it to be very comfortable. We want movement of the massage from the paws or from the limbs towards the heart or towards the trunk. This is kind of a technique that is going to help to enhance blood flow, enhance circulation, and reduce inflammation and reduce swelling in the pet. We do not want to massage over or on or around the incision in the immediate post-op period. And I'm suggesting that that immediate period is within the first 2 weeks after surgery. We also want to be cautious about where we massage in a pet when they have just had surgery. We do need to consider that they might need massage techniques in areas of secondary compensation. So if they've had surgery in one of the back legs, we actually might benefit them more by massaging them in their front legs, in their shoulders, in their neck, rather than directly in that area where they've had surgery. Again, I would defer to your veterinarian or your animal rehab practitioner or physical therapist with regards to specific instructions. When should you massage your pet? End of the day is a great time to massage your pet. Everyone's resting, it's a bit of downtime, you're a little more relaxed and probably likely to be more attentive and not rushed to move on to another activity in your day. Always massage after a warm-up. And that warm-up might actually be a leash or sling walk. So you might walk them outdoors, let them pee and poo, come back indoors, sit down and do a little bit of massage or hands-on technique with your pet. We can do massage before passive range of motion. And ideally in the pet that might be painful after surgery or after injury, we should do massage about 20 or 30 minutes after giving medications. When should I not massage my pet? If they're painful, if they're sedated or sleeping, If they're resistant to your touch, if they move away, if they give you some indication that they're not happy with what you're doing, we should not massage them in areas of infection or over open wounds or incisions. So above all, do no harm. We want our pet to be comfortable and also be trusting of your hands. We want it to be a positive experience for the both of you. How should I massage my pet? We ask permission by offering our hands to our pet, by talking to them quietly and slowly during the process, by putting our hands first in an area where we know that they're comfortable, and allowing them to relax and communicate to us that they are willing to let us massage or put our hands on them. We want to provide a comfortable and relaxing environment for massage. So quieter, maybe a little darker. Music is not always necessary, but can be helpful. We want to maintain comfortable contact with our pet. So always either having a hand or some part of our body in contact with our pet. Obviously, if they move away, if they're resistant to our hands-on, then we allow them to be. But by keeping a hand on them, that makes the massage techniques more predictable to them. They're less likely to be anxious or startled. I would always start massage in a safe area. So someplace where we know that they are comfortable, where they like to be touched. That might be the top of the head. It might be under their chin. It might be on the side of the right hip. Where is their safe area? Where do they feel comfortable? We want to move slowly, again, with their permission, move from the periphery or from their paws or from their limbs towards their heart. So what about your hands? We want your hands to be big, so spread out, not so close in, not pointed or poking. We want them to be relaxed. We want you to use your whole hand and not the fingertips. Distributing that force across a larger area tends to be more comfortable for the pet. And where should I massage my pet? Again, we talked about these areas of secondary compensation, especially in the neck, the shoulders, or the back. But we also can massage in those primary areas, which might be sore based on injury and based on how the pet is having to move after surgery. This might include the low back. This might include the hind limb from the toes all the way to the hip. Now, understanding that some pets are very adverse to being touched on their toes or on their feet. You know your pet best, and you should avoid these areas. Because they've had surgery and because you're starting to do massage does not mean that all of a sudden they are less adverse to being handled at their toes or at their paws. So what if massage doesn't go well? I would say regardless of whether it goes well or doesn't, consult a massage therapist or a physical therapist or rehab professional certified in providing, massage or manual therapy to animal patients. If they're still adverse to you putting your hands on, one trick might be to use a blanket or a towel between your hands and your pet. Maybe use gloves, or I've heard owners using spoons or other, toys and different tools to slowly stroke along the pet's body. Again, keep things positive, keep them comfortable for you and your pet. Don't force massage. Ask a professional for more help. There are tons of videos online about massaging your pet. But if in doubt, ask questions, ask for help. We want you to benefit as well as your pet to benefit from these techniques. If you need more information or to connect with a rehab professional in your area, please feel free to reach out to me, whether through social media, through Teachable, through email, whatever route is best for you. I'm happy to connect you and to hook you up with someone in your area who has appropriate training and who could best advise you with regards to massage techniques. Thank you so much and have a fabulous day.